Supply chain of COVID vaccine and how they reach the districts. The center has stopped supplying doses free of cost to private hospitals. All eligible beneficiaries now need to pay as much as rupees 1250 for a shot of Covax and rupees 900 for a Covishield shot at two private hospitals in Punjab where vaccination for 18 plus has started. Even as the center announced the vaccination drive for 18 to 44 years of population from May 1 onwards, several states could not start the process primarily because of shortage of vaccines as also for other related issues. Though the phase 1 and phase 2 of vaccination drive is underway for healthcare workers, frontline workers and 45 plus population, Punjab is yet to begin phase 3 of the vaccination drive. Gopal explains the supply chain of vaccines, how they reach the states and then the districts, and why the supply runs out within a few days. How are vaccines being supplied to the states? Phase 1, Healthcare frontline workers, and phase 2 for people above the age of 45. The COVID jabs, both Covishield and Covaxin, were directly supplied to the states free of cost by the center. For phase 3, the vaccine manufacturer Serum Institute of India SII for Covishield and Bharat Biotech for Covaxin will supply 50% of their monthly manufactured doses to the government of India and will be free to supply the rest of the state government and private hospital at a cost under the new liberalized pricing and accelerated national COVID-19 vaccine strategy which came into effect from May 1, 2021. State governments will continue to get vaccines free of cost from the center for phase 1 and phase 2 beneficiaries but will have to buy vaccines for phase 3 18 to 44 age group. Inoculations private hospitals too will have to buy the jabs from manufacturers. So what is the liberalized pricing and accelerated national COVID-19 vaccine strategy? Under the center's new vaccination strategy, two channels have been created for vaccine supply. One involving the Government of India and the second other than the Government of India channel. The vaccine manufacturer Serum Institute of India SII for Covishield and Bharat Biotech for Covaxin will supply 50% of their monthly manufactured doses to the Government of India and will be free to supply the other 50% to the state government and private hospitals. How has the new policy impacted the price of vaccines? Vaccination remains free for healthcare workers, frontline workers and 45 plus population at all government centers. For 18 to 44 category 2, the jabs remain free of cost at government centers as announced by state governments including Punjab. The center gets Covishield and Covaxin at rupees 150 per dose from the companies, while SII is charging rupees 300 per dose for Covishield from states. Covaxin cost rupees 600 per dose for states. The rates are even higher for private hospitals. Covishield rupees 600 per dose and Covaxin rupees 1200 per dose. The center has also stopped supplying doses free of cost to private hospitals. All eligible beneficiaries now need to pay as much as rupees 1250 for a shot of Covaxin and rupees 900 for Covishield shot at two private hospitals in Punjab where vaccination for 18 plus has started. The policy, however, says the charges of private hospitals will be monitored. Why has the Punjab government failed to start vaccinations under phase 3? Punjab is still waiting for the delivery of its first consignment of vaccines from SII Pune against an order of 30 lakh doses of Covishield that it has placed for phase 3 beneficiaries. Some private hospitals in Punjab, primarily Fortis Mohali and Max Hospital Mohali, which have procured doses, have started paid vaccination for 18 plus. Neighboring states such as Haryana and Rajasthan have already received the first batch of their ordered vaccine and are inoculating their 18 plus population free of cost. The vaccine supply for 45 plus beneficiaries is ongoing as usual by the center and from May 1 to 15. Punjab has been allocated 6.15 lakh doses. 4.63 lakh Covishield and 1.52 lakh doses of Covaxin. of which 3.75 lakh doses, 3 lakh Covishield and 75,000 Covaxin doses have been received so far. Cumulative, as per data released by the center on Thursday, around 40.61 lakh vaccine doses have been supplied to Punjab till date since January for healthcare frontline workers and 45 plus, of which 38.97 lakh doses have been consumed, including 4.98% wastage. As of May 7, just 2187 beneficiaries from 18 to 44 years have been vaccinated in Punjab as per center's data. Since the drive has failed to start in government hospitals of Punjab, the data is mainly from private hospitals, said a senior health official. So what is the center's criteria for allocating vaccines to states for 45 plus? The policy says Government of India from its share will allocate vaccines to state union territories based on the criteria of performance, speed of administration, average consumption, extent of infections, number of active COVID cases. Wastage of vaccines will also be considered in the criteria and will affect the allocation negatively. Based on the above criteria, state-wise quota will be decided and communicated in advance. Second dose of all existing priority groups wherever it is due would be given priority. How vaccines reach the districts and why do they run out? In Punjab, vaccines arrive in batches of few lakhs in one go. They are then distributed to districts based on population and number of active services, with just a few thousands reaching different centers, which exhaust them in a day or two. Dr. Rajesh Bhaskar, Nodal Officer COVID-19 Punjab, says the supply chain from the center is via two routes. Air route, where vaccines come directly from SII Pune, and road from Government of India's warehouse in Karnal. Vaccines land in Chandigarh, from where districts collect doses in their vans within 24 hours. Bigger districts as per population are given more doses, with allocation also depending on per day consumption and wastage. There are 729 cold chain points in Punjab which have ice-lined refrigerators. From those points, vaccines are transported to cities and villages. Dr. Bhaskar. Supply and demand is mostly neck and neck, so we hardly keep anything in stock at Chandigarh, he said. Thank you.